Welcome back to Module 6, Altered Senses, eye, ear, nose, and this one will focus on ear, and if I have enough time, I'll cover the nose during this recording. I know I said earlier, but I just wanted to reinforce that the sensory neural hearing loss can occur from damage to the cochlea, and that is the eighth cranial nerve, or the brain. Now, if a patient comes to you, speaking of our older population, and saying that the hearing has decreased, now one of the first actions we should do is look for a buildup of wax in their ear. That would be one of the first actions we would do. Real simple and easy to do. In your book, it talks about a myringotomy. I just basically want you guys to know about patient teaching. So make sure you tell the patients that they cannot shower or get their hair wet for 1 week after surgery. So I know in some of the hospitals, patients still want to wash their hair. We do have those dry shampoo caps that they can use. So that's a really good suggestion for the patient. Well, I know some patients get really dizzy, they get nauseated and sick when they go on the water, be it a cruise or even a small boat or a large ship. So a lot of times the doctors, they order meclizine, Meclizine. Please look that up. Meclizine can successfully treat vertigo, which is that uneasiness, unsteadiness, like dizziness, associated with motion sickness. So most doctors, they will order meclizine. And always with your drugs, know your brand and your generic. So you know that meclizine, you know that your brand name is more than likely Antivert. In chapter 48, we're speaking on chapter 48 now. I know I talked a little bit about the hearing loss. I just want to read this off to you so you guys can understand. When you're talking to patients, you can give them a good rationale. Now, a chainsaw becomes dangerous to hearing after 2 hours of exposure without hearing protection. The patient needs to be referred as a priority to the physician. Normal car traffic is safe for normal car traffic is safe for more than 8 hours. Motorcycle noise is safe for about 8 hours. The safe exposure time for a front row rock concert seat is 3 minutes. Now, any type of procedure, you pulling anything out of somebody's ear, whatever you're doing to the patient, make sure you use your hand hygiene. Okay? And if you're possible dealing with any type of fluid, you're going to don your gloves. Now, I hope you get this opportunity to irrigate some ears. I didn't until I started nursing a while back. But when you do irrigate ears, just know you want to make sure that if the patient becomes nauseated at any point, you stop the procedure. You don't wait and then reposition. You make sure that you stop the procedure during ear irrigation if they become nauseated. Now, since we're still talking about the ears, we got to worry also about ototoxicity. So in your book, it speaks about that. Make sure you're looking at antibiotics. Certain antibiotics, they do cause ototoxicity. So you want to make sure you're looking at your patients. Remember, critical thinking, putting that whole piece together. Look at your patient's kidney function and make sure that their kidneys are working so they can excrete the byproducts of it. So we want to make sure that we're looking at the entire picture when we're taking care of patients, okay? Just know that certain antibiotics, and I don't know all of them, but certain ones do cause ototoxicity. So make sure you review the antibiotics. Also, when we're teaching about hearing loss, still with chapter 48, we want to make sure that just simple teaching, you know, when folks are on motorcycles or bikes, that they're wearing a helmet, right? We know that swimming can lead to hearing loss if the patient has repeated infections. Fireworks displays are allowed, but usually brief and only occasional, so that doesn't contribute to any hearing loss. And to repeat again, nothing smaller than the patient's fingertip should be placed in their ear canal. Sometimes when patients have problems with the ears, like tinnitus, it can't really be treated adequately. So unfortunately, not unfortunately, this might be helpful. We can refer them to support groups, either online or, in person. And sometimes the folks in those groups can tell the patient what they're doing to help out and what are things that they're doing to deal with the situation. So support groups are good. Let's talk a little bit about meningitis. So we're still talking in chapter 48. Meningitis is a complication of mastoiditis. So the patient should be taught to take all antibiotics prescribed, report any manifestations of meningitis, such as fever, headache, and that stiff neck. So make sure you tell them, hey, keep your follow-up appointments is important. So all of those things are very important. The fever, the headache, or stiff neck, they need to report right away. Let's talk a little bit about Meniere's disease. Now with Meniere's disease, in your reading, you know that the patient have vertigo, but the vertigo can be so severe that they can fall. And this is the point that when the nurse would need to put up the side rails to keep the patient safe from falling out of bed due to the intense swirling feeling, and they will fall. So that's one. We just have to really do documentation and explain why we have the rails up for this patient. Moving on, sometimes patients have tumors, and unfortunately, some have tumors all the way down in the inner ear. So when they have the surgery, just know that more than likely their hearing is affected. It's going to destroy the hearing. So we need to make sure that we teach our patients about that end result. The physician will also, but removing an inner ear tumor will likely destroy the hearing in the affected ear. Not both ears, but in that affected ear. So in the PowerPoint, it does talk to you guys, the PowerPoint from the book talks to you about the structure of the ear, of the inner ear. So just know that you have the cochlea, the organocorti, the semicircular canals, and the vestibules, or vestibule are all part of the inner ear. Okay. Now with our older population, again, I wanted to stress on hearing. So hearing acuity decreases in some older adults, but the nurse would not assume that all older adults have hearing loss. Okay, so I use the word some older adults. Hair in the ear canal does become coarse and longer with aging, and especially in men. Okay, so hearing function may decrease with wax buildup, and then of course that can cause changes, the changes in the hearing. Also, the pinna does become elongated because of the loss of subcutaneous tissue and decreased elasticity. Just like any other person, we're going to discourage the use of cotton swabs and ear candles to clean the ears or remove wax. Okay. So basically, we want to teach the patient and the caregiver to irrigate the ear canal weekly or whenever he or she notices a change in their hearing. I believe I said this earlier and probably on some previous exams, but just make sure that a consent is signed prior to any exam. Make sure a consent is signed and it's on the chart or in the electronic medical record scan prior to any exam. And if there's any pre-op medications that need to be given, the registered nurse is responsible for giving those medications, i.e. like antibiotics. Now, I wanted to make sure we talk about hearing aids. Very, very expensive. We need to make sure we label the lid and the container that it's in on the outside and label the lid. We want to make sure we be careful not to drop the hearing aid when handling it. Turn the hearing aids off when the patient goes to bed. Use a toothpick to clean the debris from the device. And then wash the device with soap and a small amount of water. We don't dip them into the water. So with delegation, we can ask the CNA or the nursing assistant to do those things for us. Thank you. Or for the patient. So let's go backwards and talk about Meniere's disease just a little bit more. I wanted to include this. Meniere's disease is an excess of endolymphatic fluid that distorts the entire inner canal system, causing vertigo, tinnitus, and unilateral hearing loss. So as a nurse, moving the head slowly will prevent worsening of the vertigo. Also, for nutrition purposes, for Meniere's disease, it includes a low sodium diet to reduce the amount of endolymphatic fluid. So knowing those things, making sure that you as a nurse that you move the patient's head slowly to prevent worsening of the vertigo, and also possibly weekly ear irrigations as needed to prevent the vertigo. Now, please remember this. Now, it doesn't talk a whole lot of it in Chapter 48, but it does talk a little about a tympanoplasty, Tympanoplasty. Now, delegation to the CNA or the nursing assistant is, or another word for unlicensed assisted personnel, the UAP. We can't tell them to keep the head of the patient's bed flat, and then of course they can take vitals postoperatively. Okay, so that head of the bed needs to be flat. The nurse administers the medication for sure. Okay, and then the patient should lie flat with the head turned so the operative side is up. We do not remove any of the gauze or the packing at all. The surgeon will remove the first dressing with all surgeries or gauze packing post-operatively. Always remember that. The registered nurse do not remove the first dressing. The surgeon comes and removes the first dressing. I think that's about it regarding the ear. I'll probably squeeze in the nose with our neuro, but right now this is the end of part 2, module 6, altered senses. Thank you for listening, and thank you.